You are very welcome to this talk. Now we're going to be talking about some fascinating information with Dr. Tina Peers. This is purely an academic discussion. Never start taking any drugs or never stop taking any drugs or take any medical advice from this channel. It's purely for educational purposes. Having said that, I think you're going to find this really quite interesting. Welcome to this talk and welcome back to Dr. Tina Peers. Tina, thank you so much for coming back.
It's my pleasure. Always a pleasure to talk to you, John.
Last time we had a fascinating discussion about mast cell activation syndrome, which I will include the link on. But we want to start being a bit autobiographical, really, Tina, at the moment. You had 40 years experience as a doctor.
Yeah.
You'd seen quite a few things. And then the COVID vaccines came along. What happened?
Well, I was told by the private hospital that I worked at that I had to have two doses. And to be honest with you, John, I didn't want any because I wasn't frightened of COVID. I realised in the spring of 2020 how to treat COVID. And I had treated about 100 people with acute COVID, and they'd all responded incredibly quickly to the treatment that I'd suggested. And, some of them would stop coughing within 4 hours. And many would feel better the next day and get up and be able to shower and get dressed and sort of get on with their lives. So it was very dramatic improvement. So I knew how to treat COVID. I wasn't frightened of that.
You're going to have to give us a clue on that, Tina. Everyone's going to be saying, what did you do?
Oh, okay. So well, it all stemmed back to a report that came out of Italy on a pathology report, because I was like everyone else reading everything I could get my hands on to try and work out what was going on and how to protect my family, my friends, my patients, And this report said it's very strange. In the lungs, what we saw clotting, we saw bleeding, and we saw hyperinflammation. Now, because my area of interest had been mast cell activation syndrome, I knew that the cytokines that are released would be histamine, which would cause hyperinflammation, heparin, which would cause bleeding, and some other prothrombotic cytokines, which could cause clotting. So I thought to myself, well, I think the people who are getting into difficulty with COVID have probably got undiagnosed, untreated mast cell activation. And it's the mast cell activation that is the overreaction of the body, of the immune system, that is actually then causing them real difficulty with breathing and so on. And therefore, if we treat the mast cell activation, they should get better. And so I thought, well, okay, what would I give them? I would give them magnesium, selenium, zinc, vitamin D, vitamin C, quercetin, because that's a mast cell stabilizer. And you can buy all of these things over the counter, and antihistamines, but not one a day, 10 milligrams loratadine or cetirizine, one a day. I told them to take one 4 times a day, which is the maximum safe dose. And so people did this. And I also told them not to drink tea or coffee or have high histamine foods because they've already got lots of histamine in their bodies. They didn't want to add to it. And I would say this to patients. So people would come to be on a Zoom call for their menopause management, and they would be coughing and spluttering and saying, in their dressing gowns, I didn't want to cancel this appointment because I know you're so busy, but actually I've got COVID and my family have all got better and I haven't, I'm getting worse. And I would ask them a few questions and I'd say, right, this is what I want you to try, and I'm going to ring you tomorrow and see how you are. And I would ring them the next day and they'd go, oh, it's a miracle. Today I'm showered and dressed, because within 4 hours of taking the antihistamines, I stopped coughing. Or within 8 hours or within 12 hours, I could feel I was turning the corner. So, and some of the family and friends of my children, some of their friends would ring up and say in tears, "My mum and dad have got COVID. I'm going to lose my parents. I'm going to be an orphan." And there was one girl, lovely girl, and her father had very, very poor chronic health, illnesses. He wasn't a great healthy specimen. And I said, calm down. We're going to do this. You need to go and buy them these things and blah, blah, blah. And speak to me tomorrow. And she said, the next day she said, "Oh, Tina, they he stopped coughing. And they're fine. They're fine today. It's all worked. This was a chap who was a chain smoker and an alcoholic. And he'd already had a heart attack and had stents, so he wasn't in great shape. And he just bounced back with the right things. So I wasn't frightened of COVID. I also didn't understand the logic of what was being said about vaccinating our way out of it. But I thought that's totally illogical because, infections constantly change and mutate and you can't play catch up. So by the time you've made it, it will be obsolete. So I really didn't follow that at all. And also I didn't understand what they were saying. Like, you need to be vaccinated to protect other people. Well, if other people have been vaccinated and it works, then they should be protected for themselves and they shouldn't care less whether you're vaccinated or not, right? So, all these things were really sort of confusing to me but I was working on my own and I didn't have any colleagues to talk to and discuss this with. And I was also, I suppose, the propaganda that was absolutely rife was working on me too. It was confusing me. And then I was told, you have to have two to be able to come and see your patients. Now, my great love is my patients. And I was like, I don't want this thing, but I do want to see my patients. And I felt I could do some good and help people. And I thought, I can't just give up for that, So, and also my children, and this is not their fault, but they were worked on by the propaganda. So they were saying, please, we were so worried about you. We love you so much. We don't want you to catch it and you're in your 60s and blah, blah, blah. And so it's like, okay. And I thought, okay, I will. So, and also I looked on Google for any things that were bad about it and stuff, and everything said it's safe and effective, it's fine, there's no data to show that it's a problem. And I was very innocent in those days and trusting and naive, very, very naive. And anyway, so I went along. I took lots of what I've just said for COVID treatment. Before I went, I was on antihistamines and stuff because I thought I'll protect myself. If that works for the spike protein of the infection, then maybe it will work for the spike protein of the vaccine. And the first one, I had no reaction whatsoever. And
Which vaccine was it?
It was AstraZeneca, 2 AstraZenecas, right? So I thought, now I wonder whether I had normal saline.
The first time.
And I know that some people are saying that that's what they did do sometimes. Some of the batches were just normal saline. So anyway, the second time I went along and I was doing my due diligence, taking all my stuff, within an hour of the injection. And I was not expecting this because I sailed through the first one, right? So I expected to sail through the second one. Within an hour, I had a tremor in my right hand. It was going like this. And I was like, what the hell is that, right? So I had this tremor that I could not stop it. And then the next morning I woke up, I've got eczema all over the back of my neck, under my hairline, which I've never had in my life. I had all this eczema. I then started getting rosacea all over my face. I had burning mouth syndrome with my tongue swollen up, like it was so painful. All my teeth felt like razor blades on the side of my tongue. It was hard to swallow. I lost weight because I didn't want to eat. It was so difficult to eat. It was difficult to talk. And sometimes when I was talking to my patients, I was talking like this because my tongue was so big, It was awful. And that suddenly happened. And then I was sitting on the carpet playing with my grandchildren with my legs sort of straight in front of me. And my left leg went into spasms, uncontrollable peripheral epilepsy. And it lasted about 12-15 seconds. It was very, very alarming. And I could not stop it. And every muscle in that leg was contracting and then going into another spasm, then relaxing and contracting. And I was really scared of that. And that happened on 3 separate occasions. And then I started getting very sensitive to foods that I'd eaten all my life would make my face go bright red. And so what had happened was I think it had switched on my pretty low-grade mast cell activation, which, had, but it didn't cause me any problems in my life. It didn't cause me any skin issues or eczema or anything. It just meant sometimes if I had a lot of spaghetti bolognese the night before, I'd wake up with a bit of a puffy face, you know. So that was the extent of it, and I would just be able to eat everything. And then suddenly now I couldn't, because if I had spaghetti bolognese, or if I had gluten or anything that was high histamine, I would be bright red in the face and just puffy and horrible. So it really switched that on for me, and it was very, very alarming, and it lasted for 2 years. And during that time, I was looking for how to clear the spike protein from the body.
So you're convinced you had ongoing production of spike protein?
Yeah.
Or
definitely.
For 2 years.
Definitely. And we know that the mast cells are covered in ACE2 receptors. And we know that the spike protein has a particular affinity for the ACE2 receptor, and it's in all our tissues, isn't it? I mean, it's in all our organs, it lines our arteries and our vessels, our circulatory system. And so it was constantly causing me problems. And this tremor did not go away. You know, my rosacea got worse and worse and worse, and etc. You know, it was just horrible. And anyway, and then I was seeing more and more patients coming to the clinic who were similarly suffering, and they had very similar stories. And some of them were much, much sicker than me. Don't get me wrong, but when you know your body and you know what you're normally like, and you can see these things are suddenly all happening, and it was immediately after the injection. So we were on a quest to sort of find how to help people and how to help myself. And then in the April of 2023, I came across the Zero Spike Project. And somebody had alerted me to it. They said, there's going to be an interesting presentation for the World Council for Health on their Monday evening, sort of Zoom, open to everybody, all the public. And I had been watching them, but I didn't watch all of them religiously. I was just busy life. So anyway, I was alerted to this and I watched it, and it was Fabio Zoffi from the Zero Spike Project. Now, this is a not-for-profit organization that he set up with a few people at the beginning of the pandemic. And they set themselves the task of trying to sort of sort out all the health issues that were caused by the infection and also by the injection. And they've written pages and pages, tomes of their scientists have studied all the effects of the spike protein in the body, and it's absolutely fantastic sort of Bible of all the problems. And they've really researched it. And then they were looking to get rid of the spike, and they realized that because it's not a human protein, we haven't developed over evolution a way of clearing it out of our bodies. So once you've got it, you've got it. And it's, which is why my symptoms persisted, etc. And they were trying different supplements out with the spike protein to see if anything would sort of clear it. And they found that ordinary NAC, N-acetylcysteine, when it was mixed with the spike protein, under the electron microscope, they could see that some of the spike protein was broken up into 6 pieces. And they got really excited about that, but it was only a small percentage, 2%, 3%, 12% maybe. I think in one study it went up to 24%, but most of the time it was less than that. And they were like, well, that's not enough. It's good. It's a good start, but it's not enough. And they were working with a quantum physicist. And he said, well, it's a bit like light and a laser beam. You can have a torch where the light is all diffuse, and then you can have a laser beam where all the light is in a very ordered way, and then it's more powerful as a laser. And so they made a machine to make all the molecules in the NAC exactly like the ones that were doing the denaturing and the breaking up. I think of it like a parade ground with lots and lots of soldiers milling around, and it's just a mess. There's loads of people milling around. They're all the same, but they're just not ordered. And then you say to them, attention, stand to attention, and they all and suddenly they're all ordered and they all look more powerful, organized, etc. It's exactly the same thing with these molecules. So they made them all line up the way that the ones that had that potential to do that, the power to do that. So suddenly you had much more of the NAC that could do the denaturing. And when they mixed it with the spike protein, having done that, having augmented it, it denatured 99.8%. So it became much more powerful.
So the ordinary N-acetylcysteine will do something, but the augmented stuff is more potent.
Much more powerful. Much more powerful. So it literally goes up to 99.8%, and it also does a couple of other things. It reduces the clots in the blood by 68%. They went down by 68%. An ordinary NAC did about 11% of the clots, but it just became much more powerful. And then it's also, now they've shown that it actually is helpful against prion disease. The prion proteins that are twisted, it sort of stops them twisting. So that's also very useful. Now, so I watched this presentation and I was like, oh, my heart was full of hope. I just thought, hallelujah, I've got something to offer my patients. And I knew it was the spike that was continuously keeping them so unwell, and myself and my symptoms. So I contacted the Zero Spike Project. That night I sent an email and they got back to me straight away. It was amazing. And they said, I said, can I get this into this country for my patients, please? How do I do it? And they said, well, let's have a Zoom call on Friday. This was the Monday. So I had the Zoom call on Friday and I explained what I did in my clinic and everything. And Fabio said, yeah, we'll get you some. We'll get it to you. No problem. So I went onto their website and I ordered it, but it took a long time to come. So I was getting impatient. And I contacted him again. I said, I haven't got it yet. And he said, oh, I'm going to send some with somebody. Meet them in London and they'll give it to you. So I met them and they gave me these bottles. So I came home with these bottles and I was like, fantastic. And now my husband had also had 2 AstraZeneca. And 2 years after the AstraZeneca, he had a tiny stroke in his temporal lobe. Now, he's very slim, very fit, he eats healthily, So it was very strange that he suddenly made this clot in his brain. Luckily, he's made a full recovery, but I really wanted to get this spike protein out of us because I was so frightened that something more serious would happen to him. Anyway, so he started on it and I started on it straight away. And after I'd been on it for 24 hours, you take 1 3 times a day. When I woke up the next day, I kid you not, I couldn't believe it. My tremor had gone in my right hand.
You'd had this tremor for 2 years.
I'd had it for 2 years and it was gone. And I was like, I didn't expect it to work so quickly. And that was amazing. The eczema on the back of my head had completely cleared, completely overnight. Is gone. And the rosacea started to clear. And I've not had the peripheral epilepsy in my left leg again. So it was just like a miracle. I was so happy, I can't tell you. Absolutely thrilled. And I've given it so then I felt I can recommend this to my patients, because like we were saying earlier, we like to try things on ourselves first. And so I started saying to patients, look, this is the data on it, because they sent me loads of data. This is the data on it. Give it a go, try it. But I did tell people to go a bit more gently than I did. So my husband and I just went straight in on 3 a day, 3 times a day. And the next day, my husband woke up with a headache and he got up, had some breakfast, which he never wakes up with a headache. So it was unusual for him. And then after breakfast, he felt so flu-like and unwell. He had to go back to bed for a few hours. And what he should have been doing is drinking lots of water, but he wasn't. He was lying in bed, thinking he's coming down with flu. And then I realised he was in bed at lunchtime and I was like, here's some water, drink some water. I think this is a detox reaction. And I spoke to the Italian group and they said, yes, people can experience detox reactions. Because by the afternoon, he was fine. He rallied. And then we had Daniele from Zero Spike, who brought us the bottles to dinner. I did a dinner party, and Nick was fine. So he sort of recovered very quickly. I didn't have a detox reaction until day 6, when I was in a clinic with face to face with patients, and I suddenly thought, oh, it's hot in here. Oh God, it's hot. And my face had gone bright red like a lobster, and then my neck was bright red, and it lasted about 36 hours. After about 12 hours, it started to calm down. It wasn't painful or itchy or anything. It was just uncomfortable, and I'm just feeling so hot, And I contacted them about that, and they said, yes, we've had people detox reactions like that too. So everyone's different. So then I started saying to patients, actually, I think what we should do is a liver detox for a week first. So take ordinary NAC, 600 milligrams in the morning. In the afternoon, mid-afternoon, take a activated charcoal or Toxiprevent or some binder, spirulina or something. Do that for a week.
So this would just be some algae you would swallow.
Yeah,
white green powder or some activated charcoal.
Yeah, or a zeolite maybe, just to detox the liver, because you're going to ask your liver to work quite hard. Once you start taking the augmented NAC, the spike protein is broken up into 6 pieces, and they've actually identified with mass spectrometry exactly which points are broken, and it's reproducible. It happens every time, the same points. And then your body can clear each of those peptide protein chunks, and it goes through the liver and it passes out into the urine.
So it breaks it into bits that are small enough for the liver to metabolize the same as it would any other drug.
Exactly. And then you pee it out. And in Italy and in America, they've got a urine test where they can see them. They check before when there's no metabolites in the urine. And then on day 8 of taking 1-3 times a day, they check it again and it's full of metabolites.
And these metabolites are specific to spike protein breakdown.
Specific. Yeah. And then they checked every week, and they say 3 months is when they started seeing it really drop down. So you want to be doing it for 3 months. And then I take it every day as well. Because
so you took the 600 milligrams of the augmented one?
The augmented one I'm taking, 200 milligrams 3 times a day. Yeah.
Right. So you started taking 600 milligrams of augmented NAC.
Yeah.
But for your patients, and we're not advising viewers watching, of course, this is just what you did for these particular patients.
Yes.
You gave them ordinary NAC, 600 milligrams a day, which is already available from Amazon or anywhere, isn't it?
Yeah.
I mean, basically, it's a chemically modified amino acid, I think, isn't it?
Yes, I think so. And it. So they did that for a week to detox their livers, and then they went on to the augmented. And I told them to take 1 a day for a couple of days, then 1 twice a day for a couple of days, and then 1 3 times a day, to try and avoid the detox reaction that I'd had and my husband had had. And people report that that's quite a good way of doing it. So I haven't had anybody come and say, "Oh, yeah."
Right. So are you still taking some activated NAC now?
Yes.
So do you think your body is still making some spike protein?
Well,
do you think it's maybe gone into your genome or something?
Well, it could be. And there was a recent study published that said 50% of the people tested were still making it something like 2 years later.
Yes.
So because they've suggested that it had exactly done that, it had changed the genome. So I don't know if I'm still making it. I hope I'm not. But I also know...
The fact that you need to keep taking the augmented NAC indicates you may be, doesn't it?
It does. And the other thing is, of course, people are shedding, aren't they? So shedding is real. Dr. Stephanie Seneff and various very top scientists have absolutely talked about this and proven it. So shedding is real. And lots of the older population are still going and having boosters and so on.
Oh, unbelievable.
And it is unbelievable. It's heartbreaking. It's heartbreaking.
Yeah, totally.
So, they will shed on us when we're standing in the queue next to them, or I'm talking to them, whatever. And so I just want to make sure I've got the augmented NAC on board. And if I go on an airplane or I go to a conference where there's loads of people, then I take 1 3 times a day again for a few days.
Yeah.
I'm not taking any chances.
It's a bit like this SV40, isn't it? People shed that.
Yeah.
And I mean, basically, I think we can assume that we've all been exposed to SV40 virus.
So. Yeah.
It came from monkey kidney cells via some vaccine. I can't remember the details of it, but
Well, it's been found in the COVID ones, hasn't it? In every vial that's been examined. So, I think.
I mean, the SV40, that's a virus. I can see how that would replicate. To shed, it's got to be some sort of prion effect, has it, to replicate the rogue RNA?
I think so. And
a prion, most people will know, but it's a proteinaceous infectious particle.
Yes.
It's where one abnormal protein comes into contact with a normal protein, but makes that normal protein abnormal. And you get a kind of chain reaction in your protein. It's a
contagious effect, yeah. Well, I think we're all subject to it. And there are some terrible stories of people who avoided having any injections and then went out with a friend in a car on a long journey who said proudly, "I've just had my booster." And you think, oh no. And then by the time they get back after a weekend away with these people, they're really ill. And and a couple of really tragic stories where one lady, she was 24 weeks pregnant, and then she had a stillborn baby, intrauterine death. And you don't, how can you prove? Well, yeah.
Yeah. And then, of course, they messed around with one of these bases, didn't they? The pseudouridine, is it?
Oh, yeah, to make it harder to clear it.
Makes it hang around.
Yeah, for longer.
And, is it making... So it's made... the pseudouridine, one of the bases in the mRNA genetic modifying vaccine, is supposed to make it last, I don't know, for a few days or a week or so. But is that meaning that sometimes it's hanging around in people's cytosol for 2 or 3 years is another mechanism for long-term. I suspect there are a group of people that are still making spike protein long-term.
I think you're right, because some of my patients...
The reason I think that is ivermectin, as you'll know, is another way. You can bind the spike protein with ivermectin. And people can have dramatic benefits while they're on ivermectin. They can titrate the dose of ivermectin down, but they can't get off it altogether.
Yeah.
Which means there's ongoing production.
I've got a few patients like that, vaccine-injured patients like that. And I have one lady who was extremely, extremely ill immediately after her injection. And so that she was vomiting, she had diarrhea, she was just dizzy, fainting, everything. And whenever she ate, she would be unconscious for 3 or 4 hours, unrousable, whenever she ate. And then she also could only sit up for 20 minutes, because if she sat up for longer than 20 minutes, the left side of her face completely drooped and she started slurring her speech. It was really, really bizarre, right? So she's got these neurological...
That's a cerebral ischemic effect, isn't it?
Yes. So she's got these neurological effects going on. And she came to me after 18 months of trying to find some help and getting no help. Lots of examinations and tests and screening that came back normal, but that doesn't help her because she's still got these problems. She couldn't work. She couldn't do anything. And I gave her ivermectin. And I said, look, 50% of the patients who come to this kind of clinic like mine do well with ivermectin, so let's try it. Well, within days, she wasn't falling asleep for so many hours or being unrousable for so many hours after food. And she could sit up for longer and longer. She could sit up for 2 hours. And then she had to lie down because her muscles had become so weak. She couldn't stay high. She couldn't sit up for longer. If she had more strength, she could have done. Anyway, she built up gradually and she could go back to work. And she could function. It was amazing, all because of the ivermectin. And then recently she contacted me and said, I need some more because I thought I was so well, I didn't need it. So I ran out. And she said, all my symptoms have come back.
Yeah. Which to me indicates there's ongoing production of spike protein. Yeah. I don't see any other way to explain that.
No, quite.
So I'm very impressed with this Italian group. They took the N-acetylcysteine. They altered the molecule. And they altered the molecule in such a way that it would basically break into 5 pieces the spike protein.
Yeah.
How did that? That's clever.
It's very clever, and they've got all this evidence. Another independent study group in Japan came back with sort of photographs from mass spectrometry of the spike, and they identified exactly where in the pockets of the spike where the N-acetylcysteine, the augmented one, was an ordinary one, the molecules that were effective, but definitely the augmented one was actually breaking it down, and they could see it was always the same peptides that were
the
being,
same bonds that were being broken.
The same bonds that were being broken every time. And I mean, it's stunning, absolutely stunning.
Incredible.
Yeah, fantastic. You can only buy it from one place, and that's from augmentednac.com. And yeah, so it's just, I think if everyone can manage it, they should do it.
Well, of course, we're not prescribing on this channel. You could take this information, which is educational, to your own doctor and suggest that. But we will be putting the link in the description. Now, my memories of N-acetylcysteine are as an A&E staff nurse. So I went back to, after I retired from academia, I went back to A&E for a while.
Wow.
And it's huge vials of this incredibly stinky stuff. Have you ever given it IV?
No.
Oh, IV is incredibly
Is it for paracetamol overdose?
Yeah, you ever give it for paracetamol overdose?
Yeah.
It mops up one of the metabolites of the paracetamol and stops it damaging your liver. It's like life-saving. So that was my experience of it. But this is giving it orally, not by an intravenous fluid, intravenous drip like we did on A&E.
Yeah.
I mean, is the benefits to ordinary acetylcysteine supplement?
Yes. Oh, yes, there are benefits because it's good for all of our organs. And it's excellent. It can go through the blood-brain barrier, which is why the augmented is so powerful. Because it can go through the blood-brain barrier, it can actually clear the spike protein from the brain. Yes, it can. It can. But the ordinary one is just less effective at denaturing.
Right.
Because it's only doing sometimes it's 2%, sometimes it's 3%. One study it was 12%, and whereas once it's augmented, so the molecules are identical. It's just the way they're vibrating, or it's just more orderly in the augmented NAC. So they're all facing the same way, or at a subatomic level, they're all exactly the same, and whatever that means.
Sounds like a chiral effect, doesn't it?
Well, and then when you add it, it's 99.8% denatured, which is amazing. And
if people couldn't afford the augmented, if they took the ordinary NAC under the supervision of their doctors, it might have some benefit.
A little, but not
as much.
No, I didn't see it helping people enough. And I mean, the stories of patients are quite incredible. I had this one gorgeous girl, 24-year-old, an artist, and she had terrible long COVID, and we managed to improve her condition in lots of ways, but she just felt like she wasn't herself anymore. And I, as soon as I tried the NAC, the augmented NAC, I texted her and I said, I think you should try this. I really think you should try this. And she got hold of some straight away. And then she texted me a few days back and she said, it's incredible, Tina. She said, my family and friends are all saying to me, oh my God, you're back. She said, my personality's just come back. I'm my normal, happy, sort of happy-go-lucky kind of self. And she said, I'd lost that. I'd completely lost that. So she was like thrilled. And I think she's done a testimony on the Zero Spike website. And then another lady who was in an Australian, Megan, an Australian nurse. She'd had several jabs because they forced them to go, down there if they were nurses, blah, blah, blah. And she had a heart attack and she went into heart failure, and she's only in her 50s, a very fit woman. She used to run every day and she was really super fit. And she went into heart failure, and I think her cardiac function went down to 45%, which is bad, right? And anyway, she'd given up, really. She was thinking, how am I going to get better? And then she saw some podcasts like this of me talking about the augmented NAC, so she got some. And within a few weeks, her cardiac function went up to 100%. And her cardiologist was like, This is amazing.
indicating that the problem with her heart failure was the spike protein toxicity.
Yeah. Yeah. And clear the spike, allow the body to heal. And yeah, because the body has an incredible capacity to heal itself if it's allowed to do the job, So
well, if there's an ongoing insult, if the spike protein is going bam, 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 it's like someone punching you in the head every 5 minutes, isn't it? You're not going until you get rid of that, until you get rid of the ongoing insult.
Yes, and it causes microclots, which is going to make oxygenation of your tissues much more difficult, isn't it? Your capillaries are going to be a bit blocked and so on. And if you've got spike protein hanging on to all the ACE2 receptors lining the endothelium of your vessels, then they're not going to be lovely and smooth, are they? They're going to be like little furry tubes,
Which could explain the accelerated atheroma that Dr. Malhotra taught us about a couple of years ago.
Yeah. Yeah, so fascinating stuff. So there's lots of testimonies of people just getting their life back by clearing the spike protein, So very, very exciting. And thank goodness for zero spike, I say.
Fascinating. And you so just remind us, you're taking one augmented NAC a day now, and that's keeping you on an even keel.
I am. But
have you tried stopping it? What happens if you stop it?
No. No, I don't want to stop it.
But there's no, you're not suffering any side effects, so.
No. Yeah. It's just more a more potent type of NAC, basically. Yeah.
So you've gone from having long vaccine syndrome.
Yeah.
To being
back to normal.
Normal.
Yeah.
Just on one augmented NAC per day.
Yeah. Yeah. Having done my 3 months of 3 times a day.
Yeah.
Yeah, to get rid of the backlog. Yeah, so
amazing. Well, let's hope patients are listening and to take this information to their doctors and get people better. I wonder, any ideas on long? I mean, does long COVID exist, or are we seeing long vaccine? No. So you can get people with long COVID who haven't had the vaccines?
I'll tell you exactly what I saw. So I was. My theory was that patients had MCAS, undiagnosed, untreated MCAS, we're getting into difficulty with the acute infection, and the treatment for MCAS helped them hugely. Yeah. And then I started hearing in the August of 2020 about patients with long COVID, so post-viral, post-infection fatigue, ME kind of picture, right? Yep. And so I thought, oh gosh, I think they're because 20% of the population have mast cell activation syndrome. And
to varying degrees.
To varying degrees, exactly. And so I thought, right, I think the ones who've got long COVID, maybe they have got the MCAS, and they've got this tendency, and their bodies just keep over responding now, and at that time we weren't so sure about how long the spike protein, we didn't know quite so much about the spike protein. So I opened a clinic on the 1st of November 2020 because I felt absolutely morally obliged to do that. I thought, if these people have got mast cell activation, they're not getting any help anywhere else on that front, I could help them, and let's see if that improves their long COVID. And lo and behold, it did. So I was very curious. I wanted to know, did they have previously undiagnosed, untreated mast cell activation? Or had the infection caused the mast cell activation de novo, from scratch? 99% of the patients had previously undiagnosed, untreated mast cell activation. So, of course, they started to respond very well to the normal, simple lifestyle measures and vitamins, minerals, probiotics, antihistamines, type 1, type 2, mast cell stabilizer kind of thing. And it was so rewarding. The work was so rewarding. And these people were seeing me before the vaccine came out. And then, of course, people started having the injections, and then they started finding their way to my clinic with vaccine injuries. But also some of my long COVID patients I'd be getting them better, and then they'd go and have a shot. And the next time I saw them, they were much worse again.
They'd be right back.
So actually,
you think the long COVID is an activation of MCAS rather than... So the vaccine injury is ongoing spike protein production. The long COVID is probably not ongoing spike protein production. It's probably a different
Well,
etiology?
no, it could be long COVID. It could be spike protein production, because the spike protein in the mast cell activation, you need to get rid of all the triggers, and there will be certain triggers that will be causing that mast cell activation, overreaction. And one of the things would be mold, stress, infections, but also spike protein. Spike protein is an absolute number one stimulator of the mast cells.
So if long COVID was caused by ongoing production of spike protein, you would expect it to respond to the augmented NAC. Is that what you're finding?
Yeah. Yes.
Right. So
Yes,
that's
definitely.
fairly conclusive then, I would have thought, unless the augmented NAC is working a completely different way.
I think it's producing the trigger, one of the triggers. Yeah. So there are also other triggers like mycotoxins and stress, and actually childhood trauma. So many people have had childhood trauma. So all of these things have to be dealt with.
It's the holistic aspect of people.
Absolutely. We have to look at somebody completely in a holistic, integrated way. And that seems to work very well. But some of the patients I'm seeing now, John, are so sick. It's sensitized their system so much. They can hardly eat anything. Some of the patients coming, they can eat like 2 foods, and they can't take any vitamins and minerals. They can't tolerate anything. The excipients in things upset them. We have to try and get things compounded for them.
And that pathology doesn't appear to be reversible.
Oh, it's really difficult. I mean, we're doing our best and we can improve things, but it's just like, it's a real heart sink. For some of them, my heart just is broken, really. But we keep going and we keep trying to discover more ways of helping them as best we can, and working with a team of people. So it's not all just down to one person. They need to see a nutritional therapist. We need maybe to look at their genetics. We need to try and maybe work with some bioresonance. There's all sorts of things.
It's also a bit depressing, really, because the fact that you still think you need to take the augmented NAC1 a day means that the augmented NAC has got rid of the spike protein and the pathology that the spike protein and the symptoms the spike protein is causing, but it hasn't stopped it being produced. So that if it had stopped it being produced, you could stop taking it. Yeah,
I suppose. I mean, I could try and stop taking it, but I don't want to because I feel so well on it, and I don't want to leave anything to chance, just in case there is some shedding going on anywhere.
But it would be interesting if you stopped it and then were able to get one of these tests that they're doing in Germany for the presence of spike protein to see if it went away, because it's hard to see if there is a change in the genome, if that is the cause of the ongoing spike protein production, which we don't know. But if there is, the only way to seal that really would be kind of blocking off the gene with an epigenetic treatment somehow. You'd have to methylate the whatever it is on the epigenetics. I would tend to understand that, but a bit depressing. But it could be long-term production of spike protein is a bit depressing.
It is a bit, but it's okay. We're one step ahead. We have to. I think we have to be, as all of us have to be, our own best health guru. And look after ourselves as best we can and be as healthy and as fit as we possibly can be. I eat organic food only. I don't have any processed food. Everything's freshly prepared. I drink mineral water or totally filtered water. I take my vitamins and minerals every day, because unfortunately the food production now the food that we eat doesn't have all the vitamins and minerals and trace elements that it should have in the quantities it should have. So even though if you're eating a good diet, you could still be deficient in some of the micronutrients and things. I take iodine every day. I exercise every day. I probably eat 1 meal a day. Most of the time. Today I'm not eating anything. I'm going to do
You're more disciplined than I am. That's fine.
48-hour fast. I'm not going to eat today. And I had supper. I had supper last night, so it's 24 hours tonight. but I'm not going to eat till tomorrow night, so I'm going to do 48 hours because it's very good for your body.
Oh, it
to
is.
do
It's just
that
difficult.
sometimes.
I tend to fast till I get hungry, then I go and get something to eat.
Yes, that is one way of doing it. But only eating when you're hungry is important because we don't need 3 meals a day, and we should. And also, the Japanese, they stop eating when they're 80% full. That's another good tip, really.
Yeah.
I find that hard because once I start eating, I want to eat a really big meal. But once a day is for me is good. And good sleep. And every morning I go out and I ground on my grass.
How
even
long do you
in
have
the
to
winter.
do that for?
Well, some people say a minimum of 6 minutes. In the middle of winter, when there's frost on the ground, I believe 30 seconds will do because it's cold. But come the nicer weather, warmer weather, I will go out there and I'll deadhead my flowers and I'll be barefoot in the garden for
long term,
half an hour before I come in.
If it is an electrical earthing effect, if that's the case, that should be just a few seconds theoretically.
Well, it should be, shouldn't it? Yes, I tell patients a few seconds
effect,
really.
I don't tend to know.
Yes, I have a grounding sheet on my bed as well. I sleep on a grounding sheet, and I found that makes my sleep much better quality and for longer. Yeah. So, I think we all have to do all of these kind of things.
And find out what works for you as an individual.
Yeah, exactly. And I like going out in the golden hour, the first hour of the day when the sun is just rising, and I like to see the sun rising. So, of course, now I'm getting up earlier and earlier, but that's fine because I naturally wake up with the sun. Yeah. So I go straight. Some people aren't morning people, are they? And they have to sort of wake up slowly. Whereas once I'm awake. Oh, is that you? Once I'm awake, I want to get up and get on with the day. So I'm out and down, and it's dark usually when I get up. And then when I see the sun is starting to come up, I go outside and do my grounding and look at the sun. Mm-hmm. Yeah, the brightest part of the sky.
Yeah.
And set the circadian rhythm.
Indeed, yeah. Oh, get the sun early in the morning, absolutely. Just to finish, Tina, you mentioned it's a separate topic, really, but you and me were both, well, I would say, conned into taking this wretched COVID vaccine. Before that, we were innocent, we trusted, and looking back, it means we were naive, which we didn't realise at the time. For your. The first 38 years of your medical career, did you basically just accept that which was handed on down to us by those on high, like I did?
Not totally. I was always a bit of an independent thinker, but I did think that the studies were true and trusted and journals and things.
I think at the start of our career, I think they were.
Yeah.
I think things have got worse in the last 10 years.
Yeah. And that's confusing, isn't it? Because to begin with, you could trust a lot of things, maybe. Yeah. And so you get into that mindset, and then it's working out when it starts to change and when it's not. So I did general practice for 7 years when I first qualified as a GP. I was a GP. And I really didn't find it very satisfying because I could not sort people out in 10 minutes. And in some surgeries that I worked, they gave me 7 minutes. How can you do that? And ridiculous. And I felt that also I didn't like prescribing drugs. So I was always trying to look at the holistic kind of approach and lifestyle and so on. And I would find that I always ran about an hour and a half late because I'd give everybody 15, 20 minutes. And I would feel that actually what they needed was a new job, a new house, maybe a new man. There were lots of things which I couldn't sort out for them. No, I couldn't write a prescription for them. So I used to give them lots of support, emotional support, and it was very draining for me because I was giving out loads and loads of positive energy to people. Very hard work. Yeah, and they would go away and they'd be enthused and a little bit up for a bit, like they plugged themselves into me and got some of my energy, And then they'd come back a few weeks later and I think, what can I do for these people? They actually need to earn more money. That's what because this is, they can't live like this. So I did that for 7 years and I thought, this isn't for me. I can't do this. And I wasn't prescribing loads of drugs like some of my colleagues were, because I just didn't feel that was the right thing to do for people, and nature was more powerful and better. And I was worried terribly about all the side effects of drugs. So I was a bit of a sort of independent thinker there. And then I moved into contraception and women's health and sexual health, and that was a very sort of much safer zone for me to work in, because everybody was well. And they really liked to come and see me to chat about what they wanted and what they could use and everything. And it was like seeing a whole load of friends, really, chatting away, and they'd tell me everything. And that felt very satisfying. And I started developing the services from nothing virtually. And we opened lots of young people's clinics, and we were getting the teenage pregnancy rate down. And these young people really trusted us. It was fantastic. Trained lots of staff. It was a great service, and I was working in that service for 24 years. But for the last year, it was destroyed because they took 30% of the budget just overnight, closed 36 weekly contraception clinics in one day in Surrey, and they went from 20 sites to 3. And it was just heartbreaking. And for a year, I worked in the new system, and I just couldn't do it. It was just awful.
And you became a menopause doctor.
Then I became a menopause doctor. At the same time, I'd already been doing that a bit, and just concentrated on the sort of older ladies. And from general practice onwards, I'd been seeing menopausal ladies, so it was just a very natural progression for me. Really. Became a menopause specialist. But in 2016, my daughter, I think I explained before, had the mast cell activation. She became very, very unwell. And that's when I developed this acute interest in MCAS, because I had to sort her out. And it just went on from there, really. But in 2020, when things started to happen, I started to see a few red flags and started thinking I had been very, very, very naive up until that point. And I just started thinking, hang on, that doesn't make sense, and that's not scientific. And why are they saying that? Because that doesn't work. And why are they closing the GP surgeries when they should be opening them for longer? They've got all the normal people to see, the coughs and colds, depression, cancers, etc. And they've got the COVID patients to see. But what did they do? They closed them. It just didn't make sense to me.
It's not a nice place to be, really. I mean, we're kind of in the real world now. But, it was kind of nice when you could trust nice guidelines, and when you thought that what was published in a journal was genuinely the best possible science, and when you could trust your senior medical officers, and you had this hierarchy of respect. It was a nice, comfortable place to be. Now, when we see the nature of the corrupt reality and the compromise of science and the compromise of medicine, it's a deeply uncomfortable place to be. But I'm glad I'm here, because it's real. I now perceive that which is reality, rather than living in some delusional matrix world. It's
I agree with you. I agree. It's a hard lesson to learn, and I felt quite bereaved for about 3 months when I started to really put the picture together.
It is. It's a grieving process, isn't it? You're grieving for the security that you once had.
And I felt very scared about the future. And, when you have children and grandchildren and things, you think, oh, my goodness. But, I've got used to the ideas now of what the truth really is. And what I have seen is the most amazing people, incredible people who are very resourceful, very intelligent, very caring, and very strong.
And your mind has been liberated to advance. You're now essentially a medical researcher, albeit through practice. But it's developments that wouldn't have taken place otherwise.
No, absolutely. And just when I thought I was going to sort of semi-retire and go, start slowly winding down, I found myself having more and more clinics and more people, and having to use my brain cells more and more, which has been an interesting and exciting challenge, really. So, we're all here for a purpose, aren't we?
I believe so. I'm convinced that's true.
I think so.
If you're watching, you're here for a purpose. I believe that is absolutely a fundamental truth about human existence. Tina, always fascinating. Before we came on air, we did talk about another couple of things, which I'm not going to bring up now. but you are sending me some information on them, which I'm going to look at. And it would be nice if we talk again about that. So some some tantalising things ahead, some really interesting developments in non-invasive medical interventions that can perhaps influence a wide range of conditions. But if you send me the links, we'll look at them and we can talk again if you'd like to.
Yeah, that'd be great.
But for now,
that
is brilliant. Dr. Tina Piers, as always, thank you very much.
Thank you, John. Thank you.